AC joint, I'm going to do what I can to stabilize these scapulas. So for that, I'm going to ask you to put your legs flat. Is that comfortable for you to do? And put your hands underneath your hips and slide them down and lock your elbows straight. That's perfect. Now, what does that do? That stabilizes his scapula, so when I thrust on the clavicle, I can move the AC joint. So that's kind of using the weight of his body and his arms to help stabilize him. And so now, stand to the side of the patient. There's two contacts that we can do. I'm doing this just medial to the clavicle, to the AC joint. I do 3 fingers. So I'm doing a finger over finger contact. 3 fingers of one hand. That's the index, middle, and ring. Cover it with the index, middle, and ring of the other finger. And stress and thrust from S to I. And it does not matter which hand is on top. Very high velocity thrusts you want for this. Another one to do these, and by the way, on your test, we'll ask you very specific questions. I won't just say, how do you adjust the superior clavicle? We'll say, show me an adjustment for a superior clavicle in the supine position using the finger contact. You know? Or, show me an adjustment in the supine position using a thumb contact. So with a thumb contact, I find the AC joint, I'm coming just lateral to the joint. I take a P to A tissue pull. That makes sure that I don't slip off the joint. And I cover that with a pisiform, so it's a covered thumb contact. Again, if it's a woman, I'd have her cover the breast. And then we simply stress and thrust S to I. So my forearm, sorry?
You said lateral to the AC joint, you meant medial?
I meant medial, that's correct.
I have no question.
Yeah, that's exactly correct. Questions? Let's have you come on and sit up. Let me ask you to take your shirt off for this one. And we'll sit facing that way. Now, seated adjustments. Again, you can have a regular chair if you want, that's fine. And every table in that room, that is your office. You can use any table that's comfortable for you for any of these adjustments. Here's the AC joint. Again, I want to be medial to the joint. And I'm going to use a hypothenar eminence contact. This is a little different, with a lateral to medial tissue pull. Then, I'm going to stabilize it. Your arm just relaxed. That's perfect. I'm going to stabilize by doing a broad contact on the distal humerus. And I'm going to distract. So now I need to position myself way to the side. So I'm away from his body so that my forearm can be vertical. If I'm close to the body, I have very poor mechanics. Very hard to thrust, but I need to keep way to the side so my forearm can be vertical. And then I'm going to stress by distracting the joint. I pull laterally at the stabilization hand, I push medially at the contact hand, and then simply stress and thrust from superior to inferior. Got it? Okay. You can put your shirt on, and would you be the next one?